anti-lymphocyte globulin for prevention of chronic graft-versus-host disease. Chronic graft-versus-host disease is a major complication of allogeneic stem cell transplantation that results in later illness and death, and a reduction in quality of life. Risk factors for chronic GVHD are the use of a peripheral blood as a source of stem cells, a history of acute GVHD, and the use of donated stem cells with high numbers of T cells.
As you learn about or plan for a blood or marrow transplant, your transplant team will help you learn about GVHD. GVHD stands for graft versus host disease. Learning about GVHD and knowing the signs and symptoms to watch for can help you be more prepared for your transplant recovery. What is GVHD? GVHD is a common side effect of an allogeneic transplant. An allogeneic transplant uses healthy blood-forming cells, also called stem cells, donated by someone else. GVHD develops when your new donated cells do not recognize your body, and as a result, your body is attacked by your new cells. GVHD can range from mild to severe, or in some cases, it can be life-threatening. GVHD may be temporary, or it may be a disease that you continue to have long after transplant. If you develop GVHD, your doctors will provide treatment and help ease your symptoms. There are things you can do to lower your chances of developing GVHD. The first tip is to take your prescribed medicines and to continue taking them even if you feel healthy. The second tip is to be alert for any warning signs and tell your doctor about any changes in your body that you see or feel. Your transplant team will give you a list of signs and symptoms to watch for. Sometimes primary care doctors or hematology-oncology specialists may not know the symptoms of GVHD. It's important for all your doctors and transplant team to talk to each other and share information about your health. If you're concerned about a new symptom, it's okay to ask your doctors to check in with each other. Your health is their top concern. The third tip is to avoid exposure to the sun. The sun's UV rays may trigger GVHD or make it worse. If you go out, make sure you always wear a hat, sunglasses, long sleeves, and pants. Also apply SPF 50 sunscreen to all exposed skin. You may also want to wear SPF clothing for added protection. And always remember that the sun on a cool and cloudy day can be just as damaging as on a hot and sunny day. The treatment for GVHD works well for many patients. However, you may need to be treated for weeks or months. This is because it can take time to find the best medicines for you with the fewest side effects. While GVHD is serious, there are treatment options, and early detection is very important. If you have questions about GVHD, talk to your transplant team, who together with Be the Match will be there to guide and support you every.
Chronic graft-versus-host disease is the leading cause of later illness and death after allogeneic hematopoietic stem cell transplantation. We hypothesized that the inclusion of anti-human T lymphocytes immune globulin (ATG) in a myeloablative condition regimen for patients with acute leukemia will result in a significant reduction in chronic GVHD 2 years after allogeneic peripheral blood stem cell transplantation from an HLA identical sibling.
Allogeneic hematopoietic stem cell transplantation is a widely used treatment for leukemia and other bone marrow disorders. In patients who receive this therapy, chronic graft versus host disease is a leading cause of late morbidity and mortality. Researchers hypothesized that giving anti-human T lymphocyte immunoglobulin, or ATG, as part of preparation for transplantation would decrease chronic graft versus host disease. But would it result in more infections and relapses? In this prospective multicenter study in patients with acute leukemia, 161 participants were randomly assigned either to the standard myeloablative regimen or to the same regimen plus ATG at a dose of 10 milligrams per kilogram of body weight for 3 days before undergoing allogeneic peripheral blood stem cell transplantation from an HLA identical sibling. After 24 months, the incidence of chronic graft versus host disease was 68.7% in the standard regimen group and 32.2% in the ATG group. The groups were similar in rates of relapse, infectious complications, and overall survival. The fact that relapses and infections were not increased with ATG was a happy surprise, since it was thought that reducing T cells with ATG might also lessen graft versus tumor effects and make the patients more susceptible to infection. The authors conclude that the addition of ATG to the standard myeloablative regimen before allogeneic transplantation resulted in a significant reduction in chronic graft versus host disease without increasing infections or relapses. Full trial results are available at nejm.org.
The human immunoglobulin of rabid human antithymocytes is a selective immunosuppressant that acts on T lymphocytes and consequently prevents them from exerting their immunological effect. Antithymocytes globulin is used to reduce the risk of rejection in transplants.
It has been 181 days since Noah has been home.
The Ferguson family chronicled Noah's battle against leukemia, then graft versus host disease in this book. It's a thick one.
He had already gone through cancer, and he had gone through chemo, and had gone through all of this. And by far our hardest battle was his graft versus host disease.
Doctors wanted Noah to get a small amount of GVHD from his stem cell transplant to eliminate remaining cancer cells, but the disease invaded his liver and gut. He was in and out of the hospital with complications for months.
He truly has some long-term digestive issues that could come back and that could cause problems down the road.
Childhood cancer researcher Dr. Leslie Keene has worked her entire career to find something to prevent GVHD. She found that therapies that eliminate bad T cells suppress good ones too, until now. The immunosuppressant rapamycin and an experimental antibody called KY1005 work together to block pathways and prevent GVHD in animal tests.
Rapamycin is partially effective by itself. KY1005 was partially effective by itself, but when we put them together is when we really saw the really amazing activity.
Noah's family is excited about the trial's potential. Maybe someday Noah will help when he grows up to be a doctor.
I've been through so much with all the doctors' help, and I want to help some other kids too.
I'm Marty Salt reporting.
Antithymocyte globulin is contraindicated to now-quote infections in which any complementary immunosuppression is contraindicated. It is also contraindicated in patients with a no allergy to rabbit proteins or to any of the components of the preparation. Antithymocyte globulin produce lymphocyte depletion, recognizing most of the molecules involved in the activation cascade of T lymphocytes during rejection of the graft, such as CD2, CD3, CD4, CDH, CD11, CD18, CD25, HLA, DR, and HLA class. T lymphocytes are eliminated from the circulation by complement-dependent lysis and even more by an FC-dependent oxidation mechanisms through the system of monocytophagocytic cells. During immunosuppressions in transplants, patients treated with anti-thymocyte globulin have a profound lymphopenia, defined as depletion greater than 50% of its baseline value. From the first day after the start of treatment, this lymphopenia persists throughout the treatment, and even after it, on average around 40% of patients recover more than 50% of the initial lymphocytary count after 3 months.
Chronic graft versus host disease, just to touch on that a little bit, it's almost like an autoimmune disease. And it occurs 100 days after transplant. And the most common sites for it are the skin, the eyes, you may have dry eyes, the liver, and that may just be some liver function tests that are elevated that they keep an eye on, the lungs, the musculoskeletal system, as well as the mouth. There may be some mouth sores or some white patches in the mouth. So going to the eyes, talking about dry eyes. So a risk factor as a result of the total body irradiation and the steroids is cataracts. So the treatment is to remove them when they are a problem. What we usually do is monitor them. So we have you see an ophthalmologist annually, and they can actually see if cataracts are forming before you even have any symptoms. So that's why it's so important that every year you're going to the eye doctor and they can keep an eye on this. And if it does become bothersome, you may get some glares in the eyes, especially when driving at night. You may have blurry vision. And most patients who have the surgery say their vision is 100% after the surgery. And then dry eyes, this could be a sign of chronic graft versus host disease. And the way to treat that is, if it's mild, usually we use artificial tears. We can use Restasis, which is a cyclosporin eye drop. And then there's actually a procedure called the lacrimal duct occlusion, where they can plug the tear duct. And that's for moderate dry eyes. And then for severe cases, there's actually something called a Boston scleral lens, which can cover the eye. We had one patient who, for years and years, she had such severe dry eyes. She had to wear goggles in the car driving. Yeah, she was an outdoorsy person, so she loved to ski, she loved to bike, and it just totally affected her quality of life. And she went up to Boston, she got this scleral lens, and her quality of life is 110% better. She's so happy. She doesn't have to wear the goggles in the car anymore. She can do the things that she enjoyed doing before. So again, the importance of communicating with the team and finding out if there are other options for side effects you're experiencing. So the mouth, like I talked about a little bit before, the graft versus host disease, you might have some white patches or maybe some raw patches. And the treatment for that is usually immunosuppressants or mouth rinses. Dry mouth is usually a side effect of the radiation and the chemotherapy. Hydration is very important. There's saliva substitute that patients can use, ice chips, and then sometimes sugarless gum or candy, key being sugarless, just to keep the mouth moist. And then dental issues, it's so important to go to the dentist every 6 months, get a good dental cleaning, because you can have tooth decay as a result of the radiation and the chemo. So, it's important to go every 6 months to